and mental well-being of students. Let us now talk to the Chief Executive Officer of Higher Health, Dr. Ramanik Ahluwalia. A very good morning to you, Dr. Ahluwalia. Thanks for making the time. Tell us about this intervention that Higher Health is making to assist students, affected students in Cape Town.
Good morning, and good morning to everyone. This is, it's very devastating. When you talk about 4,000 human lives at this moment, and my heart goes to also including to the frontline team, the management that has been working day and night, evacuating our students to hotels. They haven't slept. I've been speaking to the management on every hourly basis, and it's been quite, my heart goes to them, and I think the entire country stands with them at this stage. From the Higher Health perspective, the biggest need at this moment is, besides the evacuation and the hotels and the financial support that is being delivered, and I really thank to lots and lots of alumni and contributors that are from the private sector that are supporting at this moment. But the mental health and the psychosocial support is predominantly the biggest need at this moment. So Higher Health at this moment has put a plan together with the university. We are actually dispatching a team of psychologists, clinical psychologists from other provinces to Cape Town. And as I speak to you, they are flying right now to Cape Town. We have our in-house team of clinical psychologists in Cape Town that have already moved to the evacuated sites. They will be providing one-on-one on-site debriefing and will be permanently placed around the students to help in debriefing, helping mental health needs, psychosocial assistance. We have then put up a team of volunteers, and I'm so grateful to a number of psychiatrists, a number of GPs and clinical psychologists through Higher Health have now established a team of volunteer support that every day in the evenings will be deployed towards group sessions, group counselings, group debriefings, and finding crisis management for young people at this moment. I will still advocate a number, 0800-363636. I repeat, 0800-363636. It's our toll-free mental health crisis helpline, a 24-hour service. We have redirected the traffic from the country to UCT to take every student's need at this moment. And as much as UCT's own lines are kind of overwhelmed at this moment, this additional national help goes quickly to support any student at this moment asking for requirement of help based on whether you are in the University of Cape Town or you're associated to University of Cape Town, or you are in Western Cape and you are feeling enormous pressures, which is quite understandable. We really request that please use this line. There's a team of expert psychologists and counselors on 24-hour basis that are available for this support. The other support that's very much that comes to our mind is COVID-19. We are in the difficult COVID-19 times. It's not that we do not have young people who are not becoming positive across our institutions, and young people have shown affinity to the virus, which is as per the new data. So we have alerted our COVID cluster outbreak investigation team at this moment in Western Cape under the Higher Health. This investigation team is built with the Department of Health, NICD, WHO, and they are on high alert so that any time required for contact tracing, for testing program, for isolation, for quarantine, for any student who will feel symptoms of COVID-19, because in this whole running around with this whole system of being evacuated to new homes, being evacuated to the hotels, that and in the middle of a major pandemic like COVID-19, we need to ensure the COVID protocols, the COVID systems are in place. But besides that, we are working with the management, with the COVID investigation team in order to be on high alert and on standby at this moment. Trainings of resident officers, security again, for further reinstating has been in touch with the management, should there be a need. So these are all the provisions. And lastly, we are dispatching toiletries, basic toiletries in the form of sanitary pads, toilet soaps. You're talking about brush, toothbrush, paste. Students have lost everything, and it's unbelievable what has happened. So it's a huge devastation, and a little anybody can do at this moment will be too little in the ocean that's needed to support the University of Cape Town.
Absolutely, and that higher health, the helpline that you gave, 0800-363636, is that correct?
Absolutely, and that's a line, and 24 hours, toll-free, and the whole team is on standby at this moment, besides the full-time deployments that's going to start.
I just want to ask you, Dr. Aluwali, it's all good and well to give help to students who are clearly and visibly in distress. But there's that cohort of students who thinks they're okay, but they've obviously gone through a major situation and don't really know as yet that they're going through, especially mental health issues. What sort of skills and interventions are you using, especially on the ground, to reach out to this group of students who thinks they're okay, but they also need help?
I think you've touched a very important point. In fact, the biggest need at this moment is also with the help of our peer educators or the student volunteers. As much as I spoke about the psychiatrists and the psychologists that are the specialized group of the people, because that comes to our mind to support young people with mental health. In fact, also the staff member. Let's not forget staff at this moment who are on the front line, and my heart goes to them who are not sleeping and really facing it on the front line at this moment. So the student volunteers, there's a very big army of higher health that is on day to day in every campus across South Africa, is being built every year on capacity trainings on mental health, gender-based violence, COVID, HIV, TB, sexual reproductive health. And I think the Cape Town community now, whether it's a TVET college called College of Cape Town, our volunteers in University of Western Cape, our volunteers in CPUT, our volunteers in Stellenbosch, our volunteers in Falls Bay TVET College, Northlink TVET College, our community of volunteers, the student needs to go. And I appeal through you, but I'm going to be reaching out to them through our own systems to volunteer towards, but also in the COVID restrictions, we need to be very limiting our number of student volunteers to support and through proper guideline and protocols, because they are kind of screening volunteers and students. So they are trained in COVID methodologies to go and assist to those students who, you are absolutely right, might not feel at this stage, but might be living with some serious trauma, that we need to reach out to them and offer further further one-on-one support or debriefing support that's required. So I think student volunteer are a huge help at this moment that will help the other peers, because there's nothing better than a peer-to-peer support.
Thank you so much for talking to us this morning.